Hi, my name is Caroline. This is my friend Julian, and we're going to talk about diabetes. So, do you know anything about diabetes?
My grandma has diabetes, so I know a little bit about it, but not much.
Okay, so to explain it, I'm going to use this picture. So basically, it's when your pancreas does not secrete insulin. So basically, this is a normal cell, and the cell would have an insulin receptor. And so the insulin binds to the insulin receptor and opens up this like glucose channel so that glucose can enter in. But if your pancreas doesn't release insulin, then there's nothing to open that glucose channel. So some symptoms would be frequent urination because all of the extra glucose that's in your blood, your body's trying to flush it out. So frequent urination, which will also cause dehydration. So you're gonna be thirsty like a lot more. Sudden weight loss is also one. Because there's no glucose in your cells for your body to use as fuel, it uses fat and muscle instead. Another one would be blurry vision because your blood vessels are more narrow because of the damage from the glucose. So then the blood vessels in your retina are going to be damaged and it will cause blurry vision. And it can also cause erectile dysfunction and numbness of your hands and your feet because your circulation is bad because of those blood vessels. And also vaginal infections because it can cause microbial growth. And then, yeah. Also, another thing with the circulation is your wounds won't heal because your blood circulation is worse, so it can't get to the wounds and the nutrients and oxygen from the blood can't get there. Does that make sense?
Yeah, sounds good.
Okay, so risk factors would be obesity because fat increases insulin resistance, and then a sedentary lifestyle also would because your body's not burning that glucose, so then it can build up. And then age would be another one, and genetics also. Some people are just more predisposed to it, and also different like habits and lifestyles can also affect it.
Why does age affect it?
Because as you get older, you're exercising less and you can gain more weight, so then that would be why. And then some complications you can have long-term would be eye problems, like we talked about with the blood vessels in your retina. And then heart disease would be another one because your heart's like working harder to pump the blood. Hypertension, which is high blood pressure, again because your heart is working harder to pump that blood. And then kidney failure would also be another one because the blood vessels in your kidneys are damaged, so then it's harder for your kidneys to filter the blood. And then some treatments would be oral medication to lower your glucose levels, and then just frequent snacking and meals can help manage your glucose levels. And then managing your blood sugar, just making sure it's at a healthy level. And then physical activity to make sure you're burning that glucose. Does that make sense?
Yeah, sounds good.
Okay, perfect.